Let's run one more time there. Just cut the whole beginning up. All right. Hi, my name is Erin, and this is Brooke. We're going to be doing an Astrand cycle test today. I'm also Brooke's acting physical therapist. This is a submaximal test that we're going to be looking at, and this is a way that we can predict Brooke's VO2 max so that we can properly prescribe her exercise. So Brooke has been warming up for 3 minutes now at a watts of 25 and at a cadence of 50 RPMs. The 50 RPMs we will maintain throughout the entirety of the test, and we're going to increase her now up to 100 watts. This is the beginning of our test. Because she is well conditioned, so we are going to put her at that 100 watts. Then after 2 minutes, I'm going to take her heart rate, her blood pressure, a second heart rate measurement, and we're going to look at Brooke's rate of perceived exertion on a scale as well. Before the test started, we determined that there was no medical supervision that was needed. Brooke is asymptomatic to cardiovascular, metabolic, and renal diseases, so we did not think that she needed a doctor present while we were doing the test today. Brooke also does not show any risk factors that are associated with cardiovascular disease, so she does not have any of those risks present as well, which is great for our test. She's also active, as was determined by the ACSM guidelines. Before we also started the test, we took Brooke's resting vitals. Her resting heart rate was at 62 beats per minute. Her blood pressure was at 115/72 millimeters of mercury. And her RPE was on a scale of, it was at 7 on that scale. These are within the normal ranges for Brooke, so we saw no need to not start the test. So we did start the test normally. We also adjusted her bike seat before she started so that she's comfortable throughout the test. It sits right at her greater trochanter. Perfect, we're getting up to 2 minutes, so I'm going to take Brooke's first heart rate measurement. Perfect. Now I'm going to take her blood pressure. Go ahead and rest your arm on your shoulder for me, or on my shoulder. Nice and relaxed for me. Wonderful. And then one more heart rate measurement. Perfect, we're at that 3 minutes. So the measurements that I just got for Brooke, I got Brooke's first heart rate at 140 beats per minute. Her blood pressure was at 130/74 millimeters of mercury. And Brooke, how are you feeling on that scale, that RPE scale?
A 9.
Perfect. Brooke's RPE is at a 9. And the second heart rate that I got for her is at 143 beats per minute. So that 140, 143, we are within 5 beats, which is what we needed to attain steady state heart rate, which means we can proceed with the test. So we're entering the next portion of this test where we're going to get our next measurements. I will take those at 5 and 6 minutes. So some instances when I would terminate this test is if Brooke's blood pressure, if her systolic blood pressure is over 200 millimeters of mercury. I would also terminate if her diastolic blood pressure changes 10 millimeters of mercury above or below what her resting vitals were. Also, if she has any adverse signs or symptoms, I would terminate the test, as well as just if she requests to stop for any reason. Feeling okay? Brooke is doing great. So we're coming up to that minute 5 when I'm going to take her heart rate again first. Ready? Nice and relaxed for me. I'm going to take her blood pressure again. Rest your arm on the shoulder. And I'm going to take her heart rate one more time once we get to that 6-minute mark. And then Brooke, how are you feeling on that RPE scale?
A 12.
So Brooke's values that I just recorded for that last portion of the test, she was at 152 beats per minute for her first heart rate. Her blood pressure was at 142/74 millimeters of mercury. Her RPE was at a 12, and her second heart rate was at 155 beats per minute. Again, we are at that steady state since Brooke's heart rate was within 5 beats per minute for both of the heart rate measures. So now we have been in 2 consecutive states where our heart rate has been in steady state, and we are within that submaximum range for her heart rate, so we can conclude the test. Now I'm going to have Brooke cool down. So I'm going to have her cool down for 3 to 5 minutes. I'm also going to bump down her wattage back to that 25. What I'm looking for is I want Brooke's resting vitals to get back to, or I want Brooke's vitals to get back to around her resting vitals. They should still be a little elevated, but they should decrease, so her heart rate will go down as well as her systolic blood pressure. Feeling good?
Yeah.
You did great.
Yep.
Whoa, can I hand that to you?
Yeah.
Perfect.
I didn't know if you said it, so I was like,
I did at the beginning,
okay,
and then
I was
like